Jodi with Real Progress in Action. I have a couple of guests today who are going to speak to us about some actions that just happened in St. Paul, Minnesota. This has to do with the hospital, with the nurses and the medical staff, and how they're being protected in this time during COVID-19. So without further ado, I'd like to introduce Steve Tuckner. He's with Twin Cities DSA. We have Bob Kucera and Zetella Caauwa, who are registered nurses at United Hospital Allina. First of all, let's talk to you, Bob. Can you tell us a little bit about what the situation is at the hospital?
I mean, since the pandemic started, it's been a stressful and frightening time to work in a hospital. We've heard a lot about the risk to the public. There's also a situation where a lot of nurses are being low needed, or being asked to take furloughs, or being asked to use their PTO. Today I was supposed to be at work and they called me and said didn't really need me. So hospital census has been down even as the number of COVID patients is increasing, but due to there's no elective procedures taking place, and a lot of people who don't need to be in the hospital are just not in the hospital. So that's led to, half the nurses are terrified they're going to lose their job, and the other half are terrified they're going to get COVID, right? So there's a lot of fear and confusion right now in general.
I'm sure it must be extremely stressful for both of those reasons. And I don't think that's necessarily something that people really think about a whole lot is, people, nurses concerned about losing their jobs. I think most people are thinking in terms of, fear for their safety. So right now we actually have a pretty interesting situation going on there with the PPE. And so has PPE been generally available? Bob?
So those surgical masks have been in pretty much available. This is really complicated, okay? Because with the CDC changed their guidelines, and they basically downgraded their guidelines. And they said, for example, to have those surgical masks, normally if I put one of those on to go in a patient room, immediately it's going to be disposed of when it comes out of the room. Well, one of the changes that they've made is to say, well, you're given one surgical mask and you wear it all day. So obviously, you don't have to have a degree in medicine to realize that if the mask itself has become contaminated, there's a chance of spreading that contamination to others. So we've seen these kind of distressing changes in the guidelines that we're given that are essentially a downgrade, obviously, in order to conserve the supply of that PPE, okay? So that's one concern about infection, that we're actually, I think, at an increased risk of transmitting illness because of those guidelines. So that's with respect to like surgical masks, okay? But the respirator masks, the N95 respirator masks, those are on lockdown. I mean, the only people who are using those are the nurses who work in the ED directly with possible COVID patients, or nurses who are working in the ICU, possibly with COVID patients. So I'm sorry if that's too much almost, but there's a lot of complexity in terms of how it's being distributed to the workers and how it's being used with changing guidelines and changing supply levels. But bear in mind that in my work, I haven't had to care for any COVID patients that I know of. So, you're going to get a different answer from other nurses. Does that make sense?
Absolutely, and I appreciate you going into the complexity of it. I mean, this is definitely something that I think people should be aware of, especially, when we hear people talk about it. I mean, I watch the daily briefings, still. They drive me crazy and I still watch it. But the thing is that, the way that things are coming down from the top, it sounds like everything is taken care of now. Everything is in a good place now. PPE is available, and PPE is going to the right places, and and all these kind of things. But it's interesting when you can say, I appreciate that you said that, because it's interesting when you can say, yes, things are being taken care of now by these new standards. And so this particular, what we're talking about right now, what the demonstration was about today, was not necessarily about specifically that. This is talking about gowns, or is it both?
So, I mean, the issue that we had at United Hospital today is really very specific. And what we're talking about right now are the hospital scrubs. So these, blue nursing uniform scrubs. Now, the way Allina policy works, every nurse is supposed to purchase their own scrubs, and then we wear them into work, we wear them home, we wash them at home. That's a normal routine. So there are supplies of hospital scrubs available. And as we've said, the physician's assistants, some of the doctors, maybe people in other procedural areas, routinely access those scrubs. I've worn them before. For example, if I got blood or vomit on me, I can change out into these hospital scrubs at the end of the shift, leave them at the hospital washes them, and that's kind of a normal thing. But what's happened now is that some of the nurses in the ICU or in the ED who are dealing with COVID on a more regular basis are trying to utilize those hospital scrubs so that they don't have to wear their clothing back home, where they risk contaminating their family. That seems like such a reasonable thing to do. There may be a shortage of N95 respirator masks. There is no shortage of hospital scrubs, and there is no shortage of laundry facilities available. This is something that Allina could very easily make happen. It is mind-boggling that they are choosing to fight on this issue. And we know that coronavirus sticks around on surfaces, including fabrics. So it's just it would seem so reasonable, to allow these nurses especially say in the emergency room or the ICU, to wear the hospital issued scrubs. But the idea that nurses are being disciplined or even being brought up to the point where they might be fired for trying to protect themselves, their patients, and their families it's unconscionable.
So, to all the frontline staff here, this is not news to you. You've all dealt with far too much of this crap over the last month and a half. And just so everybody knows, I don't have a trust fund, all right? So when I'm taking these actions about what I considered a minimal protective measure for nursing practice, and that is commonly utilized by hospitals across the country, I had no idea that Allina would come back so aggressively and so vindictively. But for those of you that went through the 2016 strike, this is my orientation apparently. We went back into the disciplinary meeting. We reviewed the email that came out just recently from Allina headquarters that said that scrubs are not PPE. Well, no shit. We all know that. A contaminated test tube is also not PPE, but you don't bring it home to your family to be contaminated. They claimed in the meeting that they do not have sufficient scrubs in the hospital. I asked them what numbers was that based on. They would not tell me. We've got OR nurses that say that there are piles of scrubs in this hospital. In addition to that, we reviewed footwear, because anybody here knows, or anybody that looks at a single study coming out of Wuhan, China, knows that COVID lives and can exist on your footwear. They again refused to give us footwear. So in that ER right now, you're walking through contaminated spaces, you're getting it on your feet, you're being given inadequate gowns that only come up to your knees. this stuff is getting on the textiles. And even in one of the studies that they cited about the repetitive N95 use, their own study says that COVID can live for 2 days on gowns. So the whole concept that you can't bring COVID home or you can't bring COVID out and reinfect your patients, we know that's a lie. We all know that's a lie.
And actually, we have one of those nurses here today. Z, let's talk about that. You've actually gotten to the point where you're having disciplinary action taken against you. And is it specifically for this issue?
So the disciplinary action that I'm experiencing, which is progressive, meaning that it can lead up to suspension or termination, is based on my violating dress code policy. So the fact that I have been wearing the hospital issued scrubs every time I work since March 31st, I have been pulled into the office with my manager, my director, and human resources. And we are now at written discipline, which means I'm very close to being terminated over this.
My goodness. And so when they pull you into the office and have this discussion with you, I mean, like Bob was saying, this seems like such a reasonable thing and such a doable thing, a reasonable thing, a doable thing, and especially in these extraordinary circumstances, something that just completely makes sense, right? I'm curious, how is it conveyed to you when they come to ask you about, when they say, oh, you may be in trouble for this dress code violation, which is interesting because I would think it's a health issue, protection issue, right? But how is it that it's conveyed to you?
So what they tell me is that wearing the hospital scrubs is not necessary, that we are given isolation gowns to wear when we go in a room that has a either known COVID patient or potential COVID patient. However, those isolation gowns only go down about as far as your knees, so the bottom of your scrubs are exposed, and then they don't close well in the back, so your back is somewhat exposed as well, which says to me that they are being contaminated when I'm in a room with a COVID patient. My employer has said that this doesn't meet the CDC guidelines. However, OSHA does have a statement on personal scrubs that become contaminated if they're not properly. Let me just read this to you. So the scrubs that we wear, I'm just paraphrasing a little bit, these would not need to be handled in the same manner as contaminated laundry or contaminated PPE unless the uniforms or scrubs have not been properly protected and become contaminated. Which means now my scrubs have become PPE and they should be laundered by a professional and not taken home to my family. So I've pointed all that out to them. I've let them know, and have not gotten any word on that. So for the first few times we were taken in for disciplinary action, we were given no actual explanation, just that this is not necessary. And now they've come out with a policy that part of the policy says that they don't have enough scrubs to allow everyone to wear the hospital scrubs. We're not doing elective surgeries right now. The day surgery center is closed. So there are piles of scrubs that we could be using. The laundry that they use has stated to the Pioneer Press that they could do 50% more laundry than they're doing right now. So their reasoning is not sound, if I could just say that. I'm not sure what their real reason is behind this, but they, instead of collaborating with us, instead of talking with us and letting us all work out a plan together, they've chosen to go directly to disciplinary actions. There are those of us who have continued to wear the hospital scrubs, and like I said before, facing termination. But most of the nurses that would like to be able to wear the hospital scrubs have been intimidated and harassed and are too afraid to wear them.
Now, oh, I'm sorry, go ahead.
No, go ahead. Thank you.
No, I'm curious. So what type of? It's such a shame that they're being intimidated. I mean, when you talk about things being, I'm sorry, I don't mean to go off on a little rant here, but when you talk about things being necessary, like in this situation, it's like, oh no, we don't have to do that. CDC says, doesn't say we have to do that, or I mean, who cares? Do what you possibly can do. We're doing all these things to show our appreciation. We should be doing all these things to show our appreciation to the nurses and to all of the hospital staff and all the essential workers and people who are taking care of us in this time. I just think it's absolutely obscene, to say, oh, well, that's not necessary. I mean, it would possibly protect you and make you feel better. If the least of what it did was make you feel better about going into work every day and make you feel safer in a situation where, many of us aren't even going out. You're right. So anyway, even if that was all it was going to do, this necessary. Oh, it's not necessary. Sorry. It gets to me. Okay. Now let me ask you, is there a significant group of nurses at this point who's standing up? And of course, we're gonna talk about the demonstration that happened today, and I know from the footage that I saw that there were a significant amount of people outside. What I'm curious about is, how many would you estimate of the nurses that are standing up?
There's about four or five of us left. And I know there's probably at least 30 nurses that would like to be able to have the option to wear the hospital scrubs. Unfortunately, again, they have been intimidated, and they're so afraid of losing their jobs that they've stopped wearing them. And it's hard for me to argue that point with them because I do know what the consequences are. The consequences of me standing up are that I may very well lose my job. But as a professional, as a nurse, it's my duty to stand up for the safety of my patients, my coworkers, my family, my community.
Absolutely. And I mean, thank you for doing that. Wow. I just, man, my heart goes out to you. I can't even understand.
So, I never signed up for this war. I did not. And if you told me in nursing school that I would be written up for putting on a pair of hospital scrubs, I wouldn't have believed you. My position has been that I'm not yielding on this, that this is a nursing practice consideration, and there's only certain standards or depths of standard that I'm willing to go to. Everybody here has a limitation on how bad the nursing practice they are willing to engage in. So I'm gonna wrap this up rather quick. We know what's going on. We know that every credible authority for the last 15 years called out the fact that there was going to be a pandemic. That because of the corporate nature of our healthcare system, with design that limits staff and that limits supply to a red line status, to do what? To make the people in that building a lot of money, that this would overrun the healthcare system, that the healthcare system would collapse and send the entire U.S. economy into collapse. For 15 years, the executive class of this hospital did absolutely nothing and walked all of these frontline workers, as well as all of these patients, into the pandemic blindfolded. Everything that we're doing here now is an attempt to overcome that lack of preparation.
We had friend of the show, Steve Tuckner, out in Minnesota, contact me today to talk about, he was a part of this demonstration. Steve, could you tell us a little bit about how you came to find out about this and support it?
We have a pretty active health justice group where we're looking into trying to help out. Usually we would be, prior to COVID-19, be concerned about things like Medicare for all. But now that this is going on, we're really trying to engage with the nurses and the healthcare workers and their problems with, it's not only, I think, that they don't get PPE, it's like the nurses were explaining that it's that the hospitals aren't really interested in or the CDC is lowering standards, and the hospitals they're not really working with the workers to figure out what's the best way to handle limited resources. They're just trying to kind of shove it down their throats. And so so we heard of a nurse we involved with DSA. We have some nurses locally, and they knew this Cliff, who was the one who had the disciplinary action today. And we heard about it on probably like Saturday night, and we started organizing people, and it wasn't just us, but we were part of this, getting this set up today at 3:00 when he was having his disciplinary hearing. And so so people showed up. We had about 50, I want to say, separated about 6 feet apart, and on the public sidewalk where we couldn't be kicked off of. And then after being there and then people also came by honking, right, as people do, right? We had honktivists. And then after being there for about 45 minutes to an hour, then Cliff came back out, and he gave a pretty nice, eloquent speech about the ridiculousness of all this. And so, yeah, that was about it.
Thank you for reaching out and for letting us know about this. I think this is something that we would all like to support in some way. And it's just, there's so much. It's just this, intense wave of just everything that is happening all the time. It's like we're drowning in crazy information that's going on all the time.
We do not know where this order for this kind of harassment is coming from. We do know that they're being investigated by OSHA. We do know that there's probably questionable charges with the Board of Nursing as well taking place. They gave me another written warning, which I did not really understand. Maybe this is to portray or project a fictitious image of being diplomatic and patient. I don't buy it. And I hope that United administrators know that I'm not backing down. My coworkers aren't backing down on their standards, and that fictitious incident command that is making one asinine decision after the next has to be breached, and it has to be occupied by frontline workers, because we've just been shown concretely how egregiously bad decision making is when it comes from people that have nothing to do with the front line of healthcare. So, for one, I gotta thank everybody for coming here. I love all you guys. I will be back here at 7 o'clock in the morning wearing the same scrubs that my buddy Ross is right there.
Woo! Woo!
Does anybody else want to add anything? No? Any questions?
I want to thank you for everything that you're doing. Your voice has been loud, and I'm grateful as a nurse, and I share your belief, and I don't think we should at all stand up in this issue. We have to stay strong.
No. I think that this is just beginning. And when you talk about the lack of the total disenfranchisement of all frontline workers in this crisis, there's one right there.
Yeah.
We have got to get rid of this corporate class from all decision making. I think that it's the only way that we can have a fair and just and moral civilization at this point. And I can't imagine anything worse than what we're experiencing right now. So,
How can people support you? I guess that's a question I should come back to. How can people support you in this effort?
I like the support that we got today. That getting some publicity around it, it seems to be the only thing that the hospital actually listens to, is public disapproval, is their public image. They're very, very concerned about their public image, and their statements will say that they collaborate with their nurses. Their statements will say that the safety of their staff is the most important thing to them, and I can tell you that none of that is true, at least not by their actions. And this is off topic, but I just want to throw this out there in that my hospital, along with other hospitals, along with government officials, have made the statements of how would we have known that a pandemic like this would happen? There was no way for us to know, which is untrue. It is absolutely untrue. There are reports about a coming pandemic going back as far as 15 years. There are even reports that give recommendations about how much PPE and ventilators hospitals and the government should have been stocking all of this time. But there's no money in storing these things. And this healthcare is a business, and it is run like a business for profits. So I just want to throw that out there, that they knew or they should have known.
Absolutely. And I think, this is case in point when you talk about, the fact that, healthcare should not be a for-profit venture, right? And I think that's what we see, especially, so just going back to it, I know I'm going to harp on this, I'm going to harp on this. What is necessary, and saying this, what is necessary? What they're essentially saying at that point is, this is the bare minimum. This is the bare minimum that we need to put into this. This is the bare amount of money that we need to pay for this, in order to theoretically get by. And in situations like this, you even take it to a national level where, we knew that we should have been stocking for this. You're absolutely right that we knew that there was a coming pandemic. So many reports, so many things that were coming out in advance. And so, yes, we absolutely knew that. But what we did was we did the bare minimum. That was essentially what we did, was the bare minimum. and it wasn't anywhere near enough. So, yeah, you wanted a businessman in the White House? That's what you get.
Exactly. Yeah.
All right. Well, thank you guys so much. I really hope that you'll check back in with us and let us know, how things progress. And I know that there are a lot of people who'd want to support you. We're going to put links in the chat below. I'm sorry, not in the chat. We're going to put links to Twin Cities DSA, and if there's any other organization that we can connect with so that we can, help you organize people and get some support. You're absolutely right. They need to know that the public disagrees and disapproves. So yeah, any attention that we can get for you, we're with it.
Thank you. Thank you so much. I really appreciate you giving us this platform. It is so helpful.
2 brief points. One is Alina must stop disciplining workers who are asking for PPE, period. Second point has to do with, we need nurses who are to become involved in the incident command process. Right now we have, we need frontline workers who are sitting at the table when important decisions are being made. Okay. So thirdly, DSA is doing a wonderful job of helping to coordinate, helping nurses find their voice in this really frightening time. And the specific hashtag links I don't have on the top of my head, but if we can plug those in, that would be great. I'd like people to know that. So that's all.
Awesome.
The one thing that Z talked about is that the only thing they seem to care about is their reputation. And while I think that's true, and I'm not in this position, right? I don't work as a nurse. I'm not working in these hospitals, but I think that in the end, this is going to have to come down to striking, because that is the only way. And you're seeing this all over, in every industry, the meatpacking industry. They just want to send people in sick and infected and send them to work, force them to work, right? People who are doing any kind of essential work. They don't want to give people hazard pay. They don't want to, they don't want to give them PPE. They just want to take them for granted and just grind them up. And I mean, they're pushing workers so hard, and they don't expect, or maybe they expect us, to fight back, and then they crush us for that. But I mean, at some point we gotta put, sand in the gears and stop this machine, because it's killing everybody.
Mm-hmm.
So thank you so much for being here today. I really appreciate you coming on our show, but more than that, I appreciate everything that you're doing. And I think that, we all owe you a lot of love for what you're doing these days, and I think that we should absolutely be supporting you in any way that we can. So, thank you.